Lots of our students have gone through traumatic experiences. I've had students who have not been in the military but have had parents die unexpectedly, or siblings or friends killed in automobile accidents. And frankly, I like to think of veterans in that context rather than thinking of them as a separate class with traumatic experiences that no one else has had. At the same time, I am aware of the fact that they have had unique experiences that are different from lots of other students' experiences.
One of the challenges that we sometimes see with veterans is that a few of them might have some psychological issues like post-traumatic stress disorder that was developed as a result of their service.
PTSD, post-traumatic stress disorder, right? So somebody that goes through something traumatic, could be a near-death experience, could be witnessing something traumatic from somebody else, and they develop a month after that about these reactions of avoidance, of re-experiencing the event, of this hyper-arousal. These symptoms are ongoing, they're affecting or impairing their functioning so that they're not able to function in the way that they normally would before the onset of the traumatic episode.
Particularly when I know a student is a vet, I watch for signs of fatigue, for jumpiness, for things that might indicate the effects of post-traumatic stress.
Sometimes a veteran, especially if they have some traumatic experiences in their past, are more comfortable sitting with their back to the wall so that they can see all the entries into the classroom or whatever room they might be in. So they've already checked sometimes all the windows and doors. They know where all the exits are. They know where all the possible threats can come in to the room. And in some cases, they won't want to sit anywhere else but right with their back to the wall so that they can see all of that.
And I have to add that not all veterans, first of all, suffer from PTSD.
You know, depending on your stats, it's 10% people, 8 to 15% is sort of what you see out there. In addition to PTSD, there's a number of other things that veterans can bring back with them. Traumatic brain injury, there's a lot being talked about now. And that's, you know, often a closed head injury. They may have been really sharp on top of things and all of a sudden they have this, maybe a concussion or something else has happened, and they come back and they can't remember things, either short term or long term, the same way. Or they used to be able to study fine, but now they come back and it's not the same for them. Physical limitations sometimes, they come back without the use of a limb, or their legs perhaps, and things are very, very different.
So those are some things that we should be aware of in terms of challenges that our students may face. And we do have campus resources in place to help students struggling with those issues.
When students come to us with documented disabilities, we take an individualized approach to determining what their accommodations will be. There are some, I guess, quote-unquote standard accommodations, like extended time for tests, maybe note-taking.
LAS provides individual academic counseling for students where we cover many of the skills and strategies that they need to be successful here at Maryland. We do workshops, we do academic courses where they can actually earn academic credit for getting learning strategies instruction, and then we have a couple peer programs where they can work with a peer to help develop skills. There is also our resource directory, which is online, and that's something that a faculty or staff member could go to find out what exactly is out there for all students. We also have a document called Helping Students in Distress. It gives them information on our services here at the Counseling Center.